Hello, Mr. Tony.
Hello.
I know you always go to Vietnam with your volunteer to train people about the knowledge and their skill about first aid and escape, especially in emergency care for very sick or seriously victim. So can you tell me about why did you choose Vietnam become a destination to help?
Well, I first came to Vietnam to help out a friend in Da Nang who was training lifeguards in rescue on beaches. And I came back 2 weeks later and just fell in love with Vietnam and the
Yes.
people. And I found out that too many people do not know enough about first aid skills. And I read in online and in papers of people dying from choking. This just shouldn't happen. Many people dying and drowning, way too many people drown. Again, this should not happen. These things are avoidable. Bleeding, people get seriously injured in streets, in accidents or at home. I went to hospital emergency department and saw many people waiting to see a doctor, but they are bleeding. And I think you need to stop the bleeding. That's the first thing to do. So I thought I can help. And with a very dedicated group of volunteers, we created a network, and we do. And I think we are making a difference, just to teach people what to do before seeing the medical professionals. Many people think that, no, we can't do that, that's what doctors do. So they take people to hospital without getting any first aid treatment at all. And that's what I try to change. In the West, we take it for granted, but here, maybe more people should learn, and that will keep their own families and their own communities safer. And that's why I fell in love with Vietnam people and needed a bit of help, and I can do that. And that's what we do.
Yes, thank you so much for choosing Vietnam. And the next one I want to ask you, as a paramedic for 25 years with the first aid experience. So can you tell me about the important roles of first aid for people should learn?
Oh, very much basic things, like choking, for example. Many people do not know how to treat a choking. It's very simple to do. Bleeding is another example. If somebody is seriously injured and they're bleeding, you only need to lose about 10% of your blood volume,
Yes.
and you're in shock. You lose 20% of your blood volume, and I'm afraid you're not coming back. You're not going to recover. Very easy to stop bleeding, but it must be done immediately in the first few minutes.
Yes.
Same with cardiac arrest. When somebody's heart stops beating, they only have 4 minutes before brain damage starts, and after 8 minutes, the heart and the brain so badly damaged, the victim won't recover. Again, these things are doable. You don't need to be a doctor to do them. In fact, it's vital to give doctors a good chance to save the victim.
Yes.
Somebody needs to do something before they see the doctor.
Yes, yes,
Doctors
I can
can't
show you.
fix seriously ill people,
Yes.
but bystanders and family members can.
So, as for you working as a paramedic, I know there must be some accident. You have witnessed that leading to the painful result because of the strong skill. So, is there any accident you still remember?
There are many, unfortunately, that have led to bad outcomes for victims. Many of them too sad to think about, but a couple in particular. There was one incident involving a group of young men who had been drinking,
Yes.
and one of them choked. Got some food stuck in his airway. His friends tried to help, but eventually when they called us and I arrived, what they were doing wrong is they were trying to clear the victim's airway by trying to reach down his throat to pull the food out. But what that had done is pushed it down even further. And even with the equipment that we have, we can usually reach down and pull things out, but unfortunately they pushed it down so far, his airway was totally blocked, and unfortunately he died as a result of very poor first aid. Another one which is very personal for me, I wasn't involved in it, but it was a first aid incident that involved my mother. She was 84 years of age. She had a fall and broke her femur, which is her hip. Now, first aid treatment for that is just totally immobilise. Don't move the victim, because it's very serious for an elderly person. My sister was there at the time and she knew what to do, immobilise. She called some people to help.
Yep.
And unfortunately, they decided to sit my mother up and put her on a chair.
Yep.
This caused internal bleeding. So initially it was just a fractured femur. First aid for that is immobilise, but because they moved her and caused internal bleeding, she died the next day. This is very personal for me, but that's incorrect first aid that caused a needless death very close to me. So many stories are too sad to mention, but simple first aid techniques save lives, and that's the important thing.
Yes, were beating. So, and how about the cheerful memory in your experience?
Well, there's lots of those. Unfortunately, paramedics and medical people, what we find funny,
Yeah.
not always funny for someone else.
Yeah,
Because
I think so.
usually it involves a victim.
Yes.
But childbirth, I think, is always an interesting experience, giving birth to children. You go from having one patient, which is the mother,
Yeah.
who is doing all the work, it should be said. The paramedics don't do much work in childbirth, the mother does all of the work.
Yes.
But then in a very short period of time, you've got two patients,
Yeah.
a mother and a child,
Yes.
and that's okay. But quite often, you'll get a third patient,
Yeah.
usually the father, who faints.
Yes.
And one in particular, the father he was overwhelmed with the excitement of it all and seeing it all, and he just fainted. And as he fell over, he hit his head on the floor, and he became unconscious. So we'd gone from one patient to three patients in the space of a minute.
Yeah.
It wasn't funny for him, but we thought it amused us. Everybody was okay,
Yeah.
it must be said.
Yeah.
It was funny for us. Most of the incidents that we find amusing usually involve alcohol in Australia,
Yes, yes.
and people doing things that maybe they shouldn't be doing. Another incident I can recall, again not funny for the victim, but we found it amusing. A man at the beach found a shell,
Yeah.
a seashell, very nice one. It was in a reserve.
Yeah.
He decided he was going to steal it. He wanted to steal this shell to take home, but he didn't have any pockets,
Yeah.
so he pushed it down the front of his pants. Now in Australia we have an octopus called a blue ring octopus, which is very tiny,
Yeah.
but can cause death because it bites and injects venom into the victim. Now this particular patient, his symptoms were he was feeling pain in both of his legs and having trouble breathing. And we couldn't find out what the problem was until we found that shell.
Yeah.
Because inside that shell was a blue-ringed octopus who obviously was not happy with the new arrangement and bit him and envenomated him. Again, not funny for him.
Yes.
He was fine, but he tried to steal the shell and got bitten. We found it amusing anyway.
Yes. Thank you for sharing. And now is the time I want you to introduce the audience about some first aid skill. Can you help me?
First aid skills, oh for sure can, surely can, yes.
Okay. Okay. Thank you so much. And now can you sharing me and audience about some skill for common accident in Vietnam?
I would be very happy to.
Yes. Quý vị thân mến, nhân dịp có Tony ở đây thì Khánh Ly cũng đã nhờ Tony hướng dẫn một vài những kỹ năng.
Okay, this is bleeding. It doesn't matter what part of the body the blood is coming from, it shouldn't come out. We need to stop it from coming out. This must be done before going to hospital or before the doctor. The only thing that stops blood coming out is pressure. So we must apply pressure straight away. We can initially use the victim's own hand to provide pressure.
Yeah.
That will give us time to find something to apply the pressure with. Once we've done that, we will need to find, if we have bandages, something like this, or if you don't have something like this, just a
Yes.
clean material. Don't put it directly on the bleed because it will stick. If it sticks, it's very hard to get off and opens up the blood again. But we can fix that very easily with a little bit of water.
Yeah.
A little bit of water on there.
Yes.
Now, it will not stick to the wound. So when we get to hospital,
Yeah.
this will come off, the wound will be closed,
Yeah.
and no infection.
Yeah.
So just apply this directly on to the wound.
Yeah.
Again, the victim can hold
Yes.
and keep pressure. It's the pressure that stops the blood coming out. That's the important part.
Yes.
Now we need to hold it in place. Instead of having victim hold it, because he may faint or anything can happen, we will use what's called a roller bandage.
Yes.
This is a flexible, stretchy bandage. This applies the pressure
Yes.
in place of the hand. Now, in something like a neck here, we can't put it round the victim's neck, obviously, because it's going to cause trouble with his breathing.
Yeah.
So we have to think of something else. The main thing is to keep the pressure on the wound, stop the blood coming out. That's
Yeah.
what we try to achieve.
Yes.
Now, in order to do that, we're going to have to try something a little different. Maybe lift the victim's arm up and apply pressure this way. So we take your hand away. Victim can now remove his hand,
Yes.
and I will use this to apply the pressure. He's still able to breathe,
Yes.
but I'm stopping the blood coming out. That's it. It's not a permanent thing. It's only there long enough to get the victim to hospital without losing any more blood. Because as I said earlier on, if you lose 10% of your blood, you've got a big problem. And if you lose 20% of your blood, you've got an even bigger problem. So this, you do not have to be a doctor to do that. That's what must be done first. That's what's called first aid.
Yeah.
It's done first.
Yeah. So for bleeding,
Ly chưa hỏi khúc này đâu, tại vì còn một cái sơ cứu bị một lúc ngón tay phía sau đây.
cái đó là not bleeding. Cái này là bleeding, cái kia là not bleeding. Hai cái khác nhau mà.
Không, còn một cái thao tác nó cũng giống tương tự như thế này, nhưng mà làm một cục ngón tay thì lúc đó em mới
Rồi,
làm kia
ok.
đó.
Yeah.
Rồi cái anh này là xong rồi đó.
So you continue for the finger, and after that I will ask you the question.
Okay. Now, in this situation, we have a severed body part. Sometimes it's a finger, sometimes a toe, sometimes a hand. Exactly the same principle again.
Yes.
We can't fix that. That's what surgeons do.
Or
But first aid is stop the blood coming out.
yeah.
That's the initial thing that we must do, stop the blood. Again, we can use direct pressure straight on the wound.
Yes.
It's not pretty, but we just need to stop the blood.
Yeah.
Same principle again. Addressing. A little bit of water, just to
Yeah.
stop it sticking. Directly on.
Yes.
And it's important to lift the wounded part up because blood comes out easier if it's hanging down.
Yes.
So we lift up, it just slows the blood flow down.
Yes.
We're just helping the body to help itself. Once again, pressure bandage. We can put as much pressure as we need
Yes.
with this. And exactly the same principle again. So you can get your thumb out of the way. And what we're doing is
Yeah.
putting pressure to stop the blood coming out. Again, as I say, I'm not a surgeon. I don't need to be a doctor.
Yes.
I need to stop the blood. And we just keep doing this. If the blood starts to soak through here,
Yes.
what that tells me is I have not got enough pressure.
Yeah.
I need to stop the bleeding. So if that is the case, we put another bandage over the top of it, and this
Yes.
time make it tighter. Once we've got the blood stopped, now we can think about what are we going to do with the body part.
Yes. Okay. And
Okay,
how
this-
about a finger?
In this case, we've got a finger.
Yeah.
If we look after this body part, this finger, the surgeons have a good chance of putting it back on. But it's important how we treat it.
Yes. Yeah.
And what we must do first is wrap it in plastic. Something waterproof, in this case plastic. Don't touch the bit where the nerves are,
Yeah.
just hold the other end. Pop it into plastic
Yes.
and seal it up. We don't want to lose any pieces of flesh. We need to
Yes.
keep everything together. So we'll seal that up. And now what we need to do is keep it cool. If this stays warm, it's
Yeah.
going to fall apart. It will
Yes.
break down. So we need to keep it cool. To do that, we're going to put it into something, a bucket,
Yeah.
a bag, even a plastic bag,
Yes.
something just like that, and fill that with water. Just fill the bag or the bucket with water,
Yeah.
but room temperature water is not cool enough.
Yeah.
So we need to put ice in with the water. We need to keep this body part just above 0 degrees. If it goes below 0 degrees, as in if we put it into ice, that's too cold,
Yes.
the water molecules inside the body part will expand
Yeah.
and break the tissue,
Yes.
and it cannot be reattached. So if we just keep it just above 0,
Yes.
it will last a long time.
Yes.
So that's very important. So we've got the bleeding under control. That's number one priority. Victim's not going to die on us. Second priority is we've looked after the body part, so now the surgeons have a good chance of putting it back on because we've looked after it properly. Happy?
Yeah.
Good.
Thank you for the service.
You're welcome.
Yes. So for bleeding and not bleeding, is there anything people should not or should avoid doing?
Yes, there's a few things. Firstly, is with bleeding, the tourniquet. A thing called a tourniquet. Sometimes somebody may want to stop bleeding by stopping blood supply
Yeah.
by putting something tight here. This stops the blood to the entire limb, to
Yes,
the whole
yes.
arm. The whole arm is not the problem. There's the problem there. That's where the pressure needs to be.
Yes.
If we cut off blood supply to whole limb, it may cause damage to nerves and to blood vessels.
Yes.
Another thing we need to avoid doing is washing it.
Yeah.
Washing the open wound. If the open wound is dirty, yes, you can wash, but just with water.
Yeah.
Never use alcohol, never use antiseptics.
Yes.
If you need to use antiseptic, put around the outside,
Yes.
not directly into the wound itself.
Yeah.
Because the body has its own antiseptic. They're called white blood cells.
Yeah.
That's what they're for, to stop infection. If we put alcohol or antiseptic directly into the wound, we kill off the white blood cells too. So it actually slows down the process. So if you need to put something, put it around the outside, but not directly into the wound. It's water and direct pressure is what's needed.
Yes.
Now this is a burn. Burns can be very serious,
Yes.
but they're very easy to treat as
Yeah,
well. Very painful. What we need to do first, and remember, when there is a burn, there is
Yeah.
going to be swelling.
Yes.
So this whole limb will swell up. We need to remove any jewellery, anything restrictive that is going to pose problems
Yes.
when we swell. Now with a burn, what is happening is the heat has gone into the tissue
Yes.
and it's basically cooking. What we need to do is cool it down again.
Yes.
We need to get this temperature of the skin back to where it should be.
Yes.
The only thing we can do that with is water.
Yes.
We
Okay.
can have some water. We will pop the hand in there,
Yes.
maybe move the water around, and we will continue doing this for about 20 minutes.
Yes.
If we take the hand out and it still hurts a lot, we
Yes.
put it back in.
Yeah.
It just means that it's cooked deeper. But we need to get the skin temperature back to where it should be.
Yes.
Once, after about 20 minutes, if we've cooled it down enough, if it's a serious burn like this is, maybe we need to go to hospital.
Yes.
But now, very, very important, we must cool the burn down first and not keep the temperature in. We must
Yes.
cool it. If we're going to hospital, it's important to not put anything on there that is going to stick. Now, anything we put on a burn is going to stick to it. So we get to the hospital, doctor will try to take this off, and all of the skin comes with it.
Yeah.
Very painful. It allows a lot of infection to get in,
Yeah.
which is the second problem with burns, is infection. So we need to cover it to keep it clean, but not have anything stick to it.
Yes.
The only thing that does not stick to a burn is plastic.
Yeah.
We can use any sort of plastic we like. But important, not like bleeding, we don't want pressure. We
Yes.
just want to keep clean. So depending on where the burn is, a hand like this, maybe we can just pop the hand in. Easy. It's not going to be there for long, just
Yes.
long enough for us to get to hospital.
Yes.
It's just first aid. It's not fixing things.
Yes.
Or maybe if the burn is up higher, maybe up here, again, we can use plastic, but not pressure. We're not putting pressure on this way. It's very, very loose, just to keep clean. Again, we can use maybe roller bandage if we have one of those, but very, very loose. Unlike bleeding, we don't want pressure this time. We just want to keep plastic on the burn.
Yes.
Now, once we've done this, there will still be pain. So now we can put ice on top.
Put
This
iron
is
on top.
on top of this.
Yeah. Yeah.
This is the first time we use ice. We do not use ice directly onto a burn.
Yeah. Yeah.
We
Yeah.
put it on now. Now we're putting ice on because it's painful.
Yes.
We're managing pain with the ice.
Yes.
And we're not putting it directly onto the skin.
Yes.
We're putting it over the top of this bandage just to keep things cool, to
Yes.
manage the pain.
Yeah. I see some people they use some traditional tip for burn like edge, you know.
Yes.
And yeah, how about
Yes.
for burn? Is there anything people should not or should avoid to do?
There are many things, but for a very good reason. Things like eggs, vitamin E cream,
Yeah.
aloe vera,
Yeah.
many different things that people can put on.
Yeah.
That will help with healing. of the burn.
Oh,
That's secondary.
yes, yes.
But first you've got to keep it cool, get the temperature back to where it should be. If you want to do something like that
Yes.
cream later, that's okay. But first get the temperature down.
Yes.
Anything you put on a burn before the temperature comes back to where it should be will keep the heat in and make it cook deeper and make the scarring worse and makes the burn worse. So initially, cool the burn down with water.
Yeah.
Then after that, if you want to put creams, that's okay. But never put cream on first when it's hot.
Yes.
Ice is another problem. Ice may feel cool when you put it onto a burn.
Yes.
But what it's actually doing is it's pulling the heat out too quickly,
Yes.
which is causing more damage.
Yeah.
So scarring becomes worse. So just water, water, and more water
Yes.
to get the temperature down.
Okay.
Now with choking, which is a very, very common problem
Yes.
in Vietnam, all over the world in fact, it's very common for babies when they're drinking milk or water or something like that, something gets too close to the top of the airway
Yes.
and the airway will close.
Yeah.
What a person would normally do to clear the airway is cough.
Yeah.
Baby not developed that reflex
Yes.
yet. So mum would usually go like that. And that solves the problem. If it's water or milk or some liquid. But if it's solid food, that's not going to work.
Yes.
It may, but it usually doesn't.
Yeah.
So solid food gets into airway closes, baby stops breathing, mum will instinctively go like this,
Yes.
but it doesn't work.
Yeah,
So
yeah.
what we now need to do is make baby cough. To cough, you need to push air out of the lungs upwards.
Yes.
To do that, we're going to turn baby over, hold head, turn baby upside down,
Yes.
and I'm going to hit right here in between the shoulder blades 5 times. Not hard, just hard enough to move some air. Immediately after that, if that hasn't worked, we'll hold baby's head again, turn baby over,
Yeah.
put 2 fingers right in the middle of the chest, right on this bone here, and do the same, 5 pushes. And we can hear air coming out of baby's mouth.
Yes.
And that is a cough. We're just trying to move it enough. If that doesn't work, we do again. And we keep doing that until the object moves away. Then baby will start to cough, and we can pick them up, and everything's fine.
Có được bán không? Okay. Can you make again for camera? Can shoot
This one?
the
From
baby?
here?
No. Wait. You just do it again. Yeah.
In between shoulder blades,
Yeah.
5 blows.
Yeah.
Then hold baby's head, turn over, 2 fingers, middle of chest, and 5 more push. Usually, that is where problem finishes. But if not, we keep doing this over and over until object comes out and baby can start to cough.
Yes.
Cough, 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 cough. Yes, good.
Yeah. Okay.
All we try to do is make baby cough, push air to move object away.
Okay. Let's start.
Now, for adult choking, choking is not the same as having a fish bone or something
Yes.
stuck in your esophagus. That's not choking. That's inconvenient, but choking that can kill you is what's called foreign body airway obstruction.
Yeah.
That's when something is in the airway, not the esophagus. In order to move that, what the body will normally do is cough. Cough. That's what moves it. So, as we have here, the victim is able to cough, so I don't have to do anything, just encourage him to cough.
Yes.
Maybe we can cough better. Inhale deeply through the nose and a big cough out.
Yeah.
So in through the nose, big one. Okay. And we must keep doing that until the object moves. The
Yeah.
object is not going to fly across the room.
Yes.
It's just got to move a little bit so he can cough it out.
Yes.
What we do not do is run up behind him and start hitting him on the back while he is able to breathe. Because it doesn't work, it doesn't do anything, and may make it worse. Because if I hit him on the back while he's inhaling, it can pull it down further.
Yeah. Yeah.
And then it becomes a complete blockage.
Yes. Yes.
Then it's life-threatening.
Wow.
So if it does become life-threatening, where he cannot cough, no more coughing, he's not able to cough. Now I have to act quickly.
Yes.
Stop coughing.
Stop.
So now I have to help him. He cannot breathe. Now it's very important. do exactly the same thing we did with baby,
Yeah.
only for adult, it's a bit bigger
Yeah.
and harder. I don't have to hold head, but lean victim forward and hit in between shoulder blades towards head. They will be much harder than this,
Yes.
but I don't want to hurt my victim.
Yeah.
5 of those, again, center of chest, but this time heel of my hand, right in the middle of the chest, and push 5 times. Push, 2, 3, 4, 5. All I'm trying to do is push air up
Yeah.
out of his lungs to move the object. Again, forward, 5 more. Oh, there was almost a cough I heard.
Yes.
2, 3, and he can cough again. Coughing, cough. Yes, he can cough again.
Yes.
I don't need to do any more of that.
Yes.
Just encourage him to keep coughing,
Yeah.
to move the object away from his airway. And he's alive.
Yes. So for talking, is there anybody have to should not or should avoid?
Yes, especially with children and infants, never put your fingers in to try to pull the object out.
Yeah.
Because it won't work. In order to pull the object out, you have to get behind it. You can't get behind it with your fingers. What you will do is push it down further.
Yes.
And that is a very bad outcome for patient. So, and number 2 thing is never hit somebody if they're able to cough. Because the one thing that moves it is the cough. If the victim is able to cough, they're able to breathe, it's not an emergency. Keep coughing.
And final question, I want to ask you, what is the message you want to give for the people for obtaining these skills?
Oh, right. Enroll in a first aid course or an emergency care course. Getting the information from places like Google, they don't give you correct medical information. They give you more websites. You have to click on the right one. But reading and research will not substitute for the actual hands-on training, because it will not prepare you for the emotional side and how people react to pain and emergency situations. It will
Yes.
not prepare you for that. So hands-on practical skill, hands-on training is the best and only way to do it properly. That way you will be prepared
Yes.
for what might happen. The shortest way to do this is with the Survival Skills Vietnam
Yeah.
program. It only takes 4 hours and it covers the basics. It's not a medical thing, it covers the basics, the things that will affect people here in Vietnam. Just enough to keep your friends and your family safe, to cover normal emergencies that might occur. That's the fastest way, but certainly a training course is vital to get the hands-on skill.
Okay, thank you so much for sharing and helping us, and I hope you will always come back to Vietnam to help more people know about this vital cure. Thank you so much.
Thank you so much, that's my pleasure.
Thank you. Quý vị thân mến, hy vọng là với những chia sẻ của Tony từ nãy đến giờ thì quý vị cũng đã trang bị cho mình một vài những kỹ năng cần thiết sơ cấp cứu trước khi chúng ta chuyển
Oh, Troy ơi!
Ngồi luôn nha, ngồi luôn.
rồi luôn kết xong rồi mình đi.
You're still star.
Nó xong rồi. Được chưa? Chuyển qua tự mà em qua ha. Dạ. Quý vị thân mến, hy vọng là với những điều mà Tony vừa mới chia sẻ trong chương trình ngày hôm nay thì quý vị đã chuẩn bị cho mình những kỹ năng sơ cấp cứu cần thiết trước khi đi đến bệnh viện để chúng ta có thể áp dụng trong những trường hợp cần thiết. Còn bây giờ thì chuyên mục trò chuyện cuộc sống cũng đã khép lại. Chúng tôi xin mời quý vị sẽ cùng đến với chuyên mục tiếp theo. Good morning, Mr. Tony. I know that you often go back to Vietnam together with the volunteer to train people on knowledge and skill in first aid and escape, especially the emergency care for very sick or serious injured victims. So, why do you choose Vietnam to as the destination to help? Thank you so much for choosing Vietnam. So, as a full-time paramedic with 25 years of experience in first aid, can you please explain clearly about the important roles of first aid that each person should learn? So, in 4 years of working as a paramedic, I know there must be in your year hả? Nãy giờ tưởng 4 years không mà hồi đầu vậy. In your years of working as a paramedic, there must be accidents you have witnessed that leaded to painful results. So, in your years of working as a paramedic, there must be accidents you have witnessed that leaded to painful results caused by wrong first aid skill. Is there any accidents like that you still remember? So, in your years of working as a paramedic, there must be accidents you have witnessed that leaded to painful results caused by wrong first aid skill. So is there any accident like that you still remember? And how about cheerful memories during your paramedic experience? Thank you so much for sharing. And now can you introduce for me and audience some first aid skill in common accident in Vietnam? Quý vị thân mến, sẵn tiện có Tony ngay tại đây thì Khánh Ly cũng đã nhờ Tony sẽ hướng dẫn với lại Khánh Ly và quý vị khán giả một vài những kỹ năng cấp cứu để chúng ta có thể thực hiện trong một quý vị khán giả thân mến. Nhân dịp có Tony ngay tại đây thì Khánh Ly cũng đã nhờ Tony sẽ hướng dẫn cho Khánh Ly và quý vị khán giả một vài những kỹ năng sơ cấp cứu trong những tai nạn thường gặp ở Việt Nam. Xin mời quý vị cùng theo dõi nha. So for bleeding and not bleeding, is there anything people should not or should avoid doing? I see some people they use the traditional tip. So for burns, is there anything people should not or should avoid to do? Quý vị thân mến, hy vọng là với những điều mà Tony vừa mới chia sẻ vừa rồi thì chúng ta cũng đã trang bị cho mình những kỹ năng sơ cấp cứu để áp dụng trong những trường hợp cần thiết trước khi đi đến bệnh viện. Còn bây giờ thì chuyên mục trò chuyện cuộc sống xin phép được khép lại. Xin mời quý vị sẽ cùng đến với chuyên mục tiếp theo. So do you have any message for the people for obtain this first aid skill? What is more effective and fast way to have? Do you have any message for the people for obtaining this first aid skill? And what is the more effective and fast way to obtain this skill? Yes. Thank you so much for. Còn một câu cảm ơn nữa. Thank you so much for helping and sharing with us, and I hope you on way come back to Vietnam to help more people know about this vital first aid skill. Thank you so much. Okay. Okay. So, how about the cheerful memory?
Baby and father all become unwell at the same time, and we have to treat all of them.
Okay, thank you. It's okay.
Being mothers with childbirth,
Yes.
we go from one victim or one patient
Yes.
to two, but we know he's not.
Yes.
It's mum.
Yeah. Được chưa chị?